So, here we are. So what is a congenital malformation? Well, it's obviously something you're born with. They happen in about 3 to 4% of all births. And the causes are still debated. We call this the polygenic model, and this means, well, we're not sure, but we think there's probably an interplay between genetic factors, maternal factors, and exposure to environmental teratogens, such as different medications, and you may know of thalidomide and others that may be involved in that. About a third of these defects are part of a syndrome, Down syndrome, Marfan syndrome. These will generally have multi-system involvement, but the vast majority of congenital defects will occur alone or with very little else, and these are what we call non-syndromic. They seem to follow some form of Mendelian inheritance, which means that they run in families, but they may skip generations, and the manifestations can vary from generation to generation. It may not be the same defect. There are some that stick to a more predictable pattern, such as the bicuspid valve. So if you have a patient with congenital defects, should you send them for genetic testing? We are still at the beginnings of such investigation. We find that generally the greatest chance we have of finding something is if they have multi-system involvement. If they're sort of what they call the FLK or FLA, funny-looking kid or funny-looking adult with dysmorphic features, or if they have other members of their family who have congenital defects. Having said that, once you've discovered in a parent or a mother or father, it is often useful to screen the children to see if they may have such defects. What is the prevalence of congenital disease? Well, we base our estimates on population basis. And this is one from my native Quebec that looked at the Medicare, because it's a public healthcare system, everyone's is housed under the same healthcare system, and it's easy to do population studies. And in that study, spanning over decades, they found that about 1.2% of children and about 0.5% of all adults have congenital heart defects. And about 1/10 of these have what's called complex, and I will define this later on. Because you're only a child for 18 years, although you may argue that some take longer to become adults, you are faced with a growing number of adults and a sort of stagnating pediatric population such that now adults outnumber, I should say, children with congenital heart defects. In the US, there are currently more than 1 million such individuals.